Now I am going to inspect his neck and spine. I'm looking at his skin and the rise of his chest from behind. It is symmetrical, no accessory muscle used from this vision point. I am going to palpate his spine for any masses or pain, starting at his neck and working my way down, noting any pain or visual abnormalities. Any pain anywhere?
No.
No. I am next going to I'm going to palpate his. I'm going to percuss his lung fields. And I'm noting any areas of density or unevenness, and the percussion does not show that. Now I'm going to listen to his lung fields. Take some deep breaths. Breath sounds are clear, no wheezing, no bronchi or crackles noted. Now I'm going to have my patient lay down on the exam table. I'm going to stand kind of behind him while he's in the supine position. I'm looking for any jugular vein distension bilaterally, and I don't see any jugular vein distension. Now I am going to look at the chest rise. It appears symmetrical with breathing, no asymmetry, skin looks good colored, it's intact, there's no bruising or rashes or scaling noted. Next I am going to osculate his heart sounds. I am going to start at the second intercostal space closest to his sternum, and I am going to be listening for the aortic valve. I'm going to move to the second intercostal space away from his sternum, and I'm going to be listening for the pulmonic valve. I'm going to move down to the third intercostal space, listening at Erb's point, and down to the fourth intercostal space, listening at his tricuspid valve. Finally, I am going to move to the fifth intercostal space using the bell of my stethoscope. I'm listening to the apex of his heart and to his mitral valve. I'm listening to his rhythm. It is loud and regular, no murmurs heard, no skipping beats heard. Next, I am going to visualize his abdomen. I don't see any asymmetry, no protrusion or masses, no hernias noted. I am going to listen to his bowel sounds first in all four quadrants. And I would do this for a full minute normally, but he does have bowel sounds present. I'm now going to use the bell of my stethoscope, and I'm going to listen to his aortic artery. I'm listening for any bruits, any pulsation. No bruits heard, no pulsation noted. I'm going to now move on to his femoral arteries, just because he's in this position, and I'm going to listen to any bruits in his femoral arteries using the bell of my stethoscope. Femoral arteries and his abdominal aortic artery are symmetrical and even when listening, and I'm going to palpate his femoral arteries now. And both are symmetrical and even. Next, I am going to palpate his abdomen in all 4 quadrants, noting any pain or tenderness. Both deep and soft palpation done. Any pain anywhere?
No.
I'm going to percuss over his 4 quadrants. I'm going to percuss over the liver, noting the density and the change in sound at the bottom of the rib. The liver does not extend past the rib. I'm going to do a deep palpation. Any pain?
No.
No. Next, I am going to, let's see, next I am going to have him sit up. Your legs here in the front. I'm going to inspect his legs. I am looking at the skin color. I am looking for any obvious signs of swelling. His skin color is appropriate, no discoloration, no redness, no swelling just by visualization. I'm going to palpate for any edema, no edema noted. I'm going to palpate his pedal pulses. Pedal pulses are symmetrical and strong. I'm going to palpate his tibial pulses on either side. Tibial pulses are both palpable and strong. I am going to palpate his brachial pulses. Brachial pulses are symmetrical, palpable, and they are strong. I am going to check a dull and sharp reflex on him. Please close your eyes and tell me if this feels dull or sharp.
Sharp.
And now?
Dull.
Reflexes and sensation are appropriate. I am now going to check his popliteal reflex on his knee. Can you sit back a little bit? His popliteal reflex is appropriate. His legs look good. The temperature is normal. And I'm sorry, that was the patellar reflex, not the popliteal. And the temperature is normal. And this will end our assessment.